Hi everyone, Assalamualaikum warahmatullahi wabarakatuh. First of all, thanks for this valuable opportunity that providing us a chance to share the overview of our study about social security for people affected by drug-resistant tuberculosis. Today, I'm Nurlianti, who will represent my team from Stop TB Partnership Indonesia, which consisted of Nini Anissa, Ahmad Imam Mujadid Rais, Dena Sundari Alif, Denny Wahyudi Kurniawan, Uga Pratama Gunawan, Indro Laksono, Henry Diatmo, Thea Hutanamon, and Lukman Hakim. In this presentation, we would like to explain several sections, including backgrounds, aims, study framework, methods, results, conclusion, and also recommendation. Well, ladies and gentlemen, as we know, drug-resistant tuberculosis, or DRTB, has become a significant health problem in Indonesia. Exploring the TB situation in Indonesia, Ministry of Health in 2021 noted that there were more than 8,000 people were diagnosed as DRTB patients. Unfortunately, only 61% of them enrolled in the treatment, which means there's still around 38.5% people who potentially transmit this disease to a worldwide community. The low of treatment rate and the low of case notification rate for DRTB will increase the risk of catastrophic cause. Indeed, the DRTB needs a longer period of treatment, which maybe takes around 9 to 24 months. And of course, it leads to a multidimensional impacts, including physical impacts, physiological impacts, and indeed a financial impacts. Therefore, in this study, we would like to explore several things, including exploring the data and information from the literature review related to the implementation of social security for people affected by TB, in their term DRTB, and then mapping policies that support the integration of the TB issues with social security mechanism, and then mapping the role of multi-stakeholder in integrating the TB issue with the social security mechanism, and identify the problems experienced by people affected by the DRTB, namely impairment in the forms of support and what expectations are needed in order to help the recovery process. Well, ladies and gentlemen, this is our study framework. During the DRTB treatment, there would be a direct and indirect cause. All of this, when we talk about health right of every people are protected by the nation. So that's why the nation should taking off the every single cost that related to the treatment. The direct cost would be related to the medical and non-medical costs, while the indirect cost, it is related to the job and productivity loss. All this expenditure will lead to catastrophic costs. Catastrophic cause is a condition which will disturb the TB elimination measure, as it will cause the patient to stop their treatment. Therefore, we need a social protection. We need to see the urgency of socio-economic assistance and support. What kind of social security program that can we integrate to support the DRTB patient? We would like to see the gap between the urgency and the current existing social protection program. Ladies and gentlemen, this is what we've done during the study. We conducted a mixed method study with convergent parallel approach. In exploring the regulation and stakeholder, we conducted a qualitative study through a literature review, focus group discussion, and in-depth interview. There were around eight key stakeholders involved in the FGD, and also there is around 21 participants were join us in the in-depth interview, and most of them are the TB survivors. In the other hands, We explored the program Keluarga Harapan or PKH, which was in place in 2020. 332 patients was enrolled in this survey, who selected purposefully from 10 provinces with high burden TB. The questionnaire was based on BPSS and also Spark. Here's the result of our PKH evaluation. Ladies and gentlemen, we can see here that regarding the PKH which was implemented in 2020, our study found that 77% of people or our respondents were eligible to receive the PKH, as 54% of them are in poor category with income under 2 million rupiahs, and 23% of them are vulnerable to poverty, as their income was around 2 to 3 million rupiahs in a month. Unfortunately, we can see here that only 23% of them confirmed that they received PKH. Well, you know, PKH was added to TB, tuberculosis was added as an additional category for health component of PKH in October 2020. People affected by TB were eligible to receive PKH. The low percentage of respondents who confirmed that they received PKH in 2020 may caused by the TB component was revoked from PKH in January 2021. It happened as the Audit Board of Republic Indonesia was found that the policy of adding component related to the TB did not have a strong evidence-based regulatory. The good news is 98% of those who received PKH felt that it was a help or support for them, as they can use it to support their daily needs, education, treatment, or business. Well, ladies and gentlemen, in our study, we also found one of solution that can be used as our social protection for people with the RTB. It is a CCT or conditional cash transfer. Several countries such as Brazil, India, Argentina, and South Africa has implemented the CCT for people with the RTB. The impact analysis also have been done to explore the effectiveness of CCT, and it's considered as a good strategy to fight TB, and it's expected to be a way in effort to fight tuberculosis. And ladies and gentlemen, beside the CCT, we also explore current 25 social security mechanism that's currently existing and found 5 potential mechanisms that can integrate the TB, the RTB as one of their components. They are the national health coverage, which is controlled by Ministry of Health, and then there is a program Keluarga Harapan and program Sembako, which is controlled by Ministry of Social Affairs. There is social assistance, especially special emergency during the COVID-19, which is also controlled by Ministry of Social Affairs. And then there is a joint business group or QB, which is also controlled by Ministry of Social Affairs, and social rehabilitation of uninhabitable home and environmental facility, which is also controlled by Ministry of Social Affairs. Well, ladies and gentlemen, here we provide you the listing of supporting regulation that can we explore as the supporting regulation to develop a new mechanism or integrate the current mechanism to the RTB patient. As we know that we've launched our presidential decree number 67/2021 about TB elimination, which every minister or every ministry have their own role in the TB elimination. In this regulation, it's mandated that people with TB have to get economical support from the government. While in integration of the social security mechanism, we identify Ministry of Social Affairs, Ministry of Health, and Coordinating Ministry for Human Development and Cultural Affairs as the key stakeholder in this measure. And it can be concluded that measure to integrate the RTB into social security mechanism provided by government is an urgent matter. This is based on the finding of our study on the catastrophic impacts that experienced by people affected by the RTB and the urgency to implement the provision of social security support. The existing social security is not yet specific for people affected by the RTB, although supporting regulation is already in place. Hence, we recommend that there should be a development of Ministry of Social Affairs regulation regarding social security for people affected by the RTB, as mandated on the Presidential Decree number 67/2021. Moreover, an intensive synergy and collaboration between Ministry of Health and Ministry of Social Affairs in terms of providing social security for people affected by the RTB, including database integration, technical preparation, implementation, monitoring, and evaluation. Well, ladies and gentlemen, thank you so much for your kind attention. We are keen on having a further discussion with you. Thank you so much.